All right, so before we start, I want to do an exercise. If you can put both feet on the floor and close your eyes and breathe out 3 times. Just follow my instructions, don't worry about them. See yourself in a room. In the middle of the room, there's a box full of balloons that are already blown up. Pick up a balloon of a color you really like. Bring it to the door or the window of the room. If the door or window are not open, open them up. And allow yourself to float up with a balloon. Let the balloon bring you up to the sky.
Mm-hmm.
Float out here in the sky.
Sorry.
Until you find a place you really like.
Mm-hmm. Mm-hmm.
When you see that place that you like, give the balloon string a little tag and land in this place that you like. Feel the air on your skin. Notice the time of day. Enjoy being here. Take a deep breath and open your eyes. Okay, so I'm originally from California, so sharing is a big deal. Anyone would like to tell me where they landed?
Sorry, I have spontaneous movement and voices as well sometimes.
Where did you land?
On a cloud.
On a cloud. Okay. What time of day? That's very typical,
In the
actually.
morning.
In the morning. Okay. Anyone
Sunrise.
else?
It was sunrise and it was lovely, really pretty.
Cool. Anyone else? Where did you land? On a cloud also.
Oh dear.
Okay, and what time of day did you say?
Midday.
Midday, okay. Anyone else?
I was on a clump of trees overlooking a big view, and it was about probably 1 or 2 o'clock because it's hazy sun.
Okay. Yeah. I did say look at you.
Yes, it's early afternoon.
All right, one more person?
Well, I'm very literal. I was just above Reading, to be honest. The way I came into here, and it was this time of day.
Okay, so that's where you landed. Did you enjoy?
No, I didn't land. Sorry, I was sort of
Oh, you never
above,
landed?
above the.
Oh, so when I said pull on the balloon string and land in a place you really like, you...
Didn't hear that bit. I flew on the roof,
Oh, okay.
and I stayed where I was.
Okay, you didn't hear that part. Okay, so you missed the exercise. It's
He's the
it's fine.
first
It's
one to
okay.
fall asleep today.
Okay, no, it's an interesting phenomenon.
Definitely.
Okay, anybody land, there's something interesting about him. If anybody, what you see is people will land usually in a place like a meadow, a cloud, the beach, something, where there's space and there's light. Okay? If somebody tells you, every so often somebody will say, I landed in this lovely little bistro in Paris where I met my lover, it's like, yeah, you can understand that, it's a place they like. It doesn't have space and light, but they, you can understand why they're there, okay? So generally, space and light are very important. Healing is going to involve the capacity to produce space and light. And I'll add one more thing to it that you don't see from this imagery, is the acceptance of the knowledge of new possibilities. When people are not willing to believe that new possibilities, I'm stuck in my illness sort of thing, they're not going to get better. They can't. So that your capacity as a practitioner to produce space and light or inspire the option of new possibilities, that's what we're doing. Everything else you'll see today is technique. But underneath it all, there has to be this understanding that we're providing the space and light for the person. So we're really not providing it, they're providing it. But we're somehow conduits of it. That's what we're trying to create. Then we're trying to direct it towards the problem. The reason I say this is because, and by the way, if somebody comes out of this image and they tell you, and I hope nobody here did, I landed in a dark cave with scorpions in it, and snakes. You die. What's the number here? 911 is a mistake. 999. Okay. You immediately dial emergency room because they have a major psychiatric disorder. You land in a place you really like, and this is where you went. I think something's wrong. You know what I'm saying? So space and light are just an essential component of what we do. And at the same time, let's be honest, and especially not in England, nobody's gonna, people don't treat outside. It's too cold. I mean, we turn the heat up so the patient will be warm, right? So, there's something about looking at so you can look like how many people, for example, have like little fountains in their treatment rooms and, all sorts of gimmicks that we do to create, inspire this idea of more space, more light, even in our treatment rooms or in our waiting rooms or whatever. So having said that, now from now on, we're going to abandon this idea altogether because otherwise it becomes a class in philosophy and sort of really deal with nitty-gritty, but I want you to just keep that in the back of your mind, that as much as we're talking nitty-gritty, behind it you also have to do something else at the same time. So how do you approach a person with a certain openness, certain spaciousness within yourself probably matters a lot more than what you do with your hands. Okay? And they're actually related. How you use your hands is going to come from the openness within you. So, because I use my hands a lot, that's what I do. Okay? So this system, in some ways we say it's a palpatory system. I want to explain to you that our to say that correctly, we can say our grandfather teacher, but in your case maybe it's your great grandfather teacher. If you haven't, for you it's still grandfather teacher because it's Kiiko's teacher, is Nagano, or this style is primarily Nagano based. Nagano was not an abdomen poker. Okay, that was not his thing. He was a major pulse person. It's Kiiko who converted that style into a much more clearly palpatory poke abdomen. Okay, so the style is known, and because she's written before she met Nagano actually, she wrote a book called Hara Diagnosis, so we call this Hara Diagnosis, it's about palpation. There is a slight misunderstanding about that in my opinion, but let's just talk about the palpation itself. We palpate. Every Japanese, self-respecting Japanese acupuncturist who writes a book is going to talk about, they're going to see in everyone, whether they're doing Toyohari or they're doing whatever they're doing, they're going to talk about, they're going to show you a picture of the abdomen. It's the equivalent in TCM of having a picture or a description of a tongue. You do not write, a case study, or you don't write a book in Chinese medicine and not just talk about the tongue. It's just not done. It's like you have to give the tongue, it's part of your differential diagnosis. Okay? In Japan, it's not respectable to not have an abdomen for your differential diagnosis. But when you watch them, when you watch what they do, at least watching in classes that I've gone to with different masters, and that includes a bunch of Toyohari people, Shudo, Denmai, Ikeda, there's a whole bunch of them that I've studied with. None of them I've studied with long term because it just never was not my style. It didn't resonate for me enough. What I see them when they treat is they'll do the abdomen, it looks like it's an obligatory thing. They never check the abdomen afterwards. What they check against to confirm the points is the pulse. They say, oh, the pulse change, yes, good point, I got the right point. I can't do it, most of us can't do it. Most of us don't have this capacity of being that sensitive to the pulse and having that kind of assurance to say, I touched a point and the pulse changed. That required huge concentration and huge capacity. Maybe when I'm 80, unfortunately it's getting closer, so maybe it won't happen, but I am hoping that when I'm old enough, at some point I'll be able to go, wow, yes, it's like that. The Toyohari people claim that they can do it. They have these study groups, and they all claim that they can say it's the same pulse. My experience is everybody you ask, the biggest masters, you go to two people and give them the same hand, they'll give you a different description of the pulse. So I'm not big on Toyohari, which is another big style that you see, and especially in the UK, of Japanese acupuncture. So I just wanted you to know it's something I can't explain, can't talk about. So when we poke, so the Japanese usually, they poke sort of superficially, and they touch, they're looking for dampness, they're not really looking for pain, pressure pain. Because to get pressure pain, we're based on a Western method of poking, which is you get up to one knuckle's depth in, okay? You may not be able to get that because it all depends on how long your fingers are, relative to the patient, but it gives you an idea that up to, you may want a little less because he has very long fingers. But, it's invasive to some extent. Now, in order to make it not, so, actually, can I have somebody on the table for a second? Don't mind exposing your belly.
Do you want to
just so that they see the
shoot stuff?
Doug, I don't care right this second. We're not treating, we're just show it. Okay. So basically, most people, unless they have some disorder in the colon, like ulcerative colitis, something, left spleen line is going to be free, usually. So I start, this is my finger. So can you see I have, by the way, come, don't. That's why I don't take notes, just, Otherwise we have to have television and project everything. So, this is no big deal, right? Okay, this is what my fingers feel like. Now, what I want you to do is so you saw my fingers, you see I'm about to knuckle in, I'm using 3 fingers. For me, it's my pericardium finger that I'm feeling with. Okay, some people feel with the index finger, it's whatever you want. I don't think it's so easy to do with a triple warmer finger. So, I'm just going, this is my finger. Now, watch my body, don't even watch my hand, okay? Okay, I'm leaning into him. Now, there's somebody in Israel who actually teaches exactly the opposite. I think it's horrible. I talked to people who studied with this person. This is not gone, by the way, a different person. He goes like this, and he insists that this, I'm like, are you kidding? So, this was no big deal, right? Now, let me do the other thing. It's not pleasant, right? No, tell me the truth.
I didn't feel too bad either.
Oh, okay. So some people will be, it's like if you just, the other thing is I may not be able to do it, but okay, so if I just go, it's a different feel, right?
Yeah.
Now, what Kiiko likes sitting, I don't, but what she'll do, she's like this. She's holding the patient this way. I don't feel it's that comfortable for me. I like the, having a better angle. So you have to discover what you want to do. I tend to hold the table to stabilize me, not so much the patient. You'll find different mechanics that will work for you, but there's a certain lean. Your hands are coming from the back of your heart. That's going to be true for you needling as well. When you needle, you don't needle with a hand. You're needling from the back of your heart. The needle's coming from here. And I'll show you that, for example, in the heart channel. There's an explanation for that. So the depth is about that, that much. Okay. Now, so I'll give you a few areas just so, So we all start teaching, it's kind of easy to teach left stomach 27, we call it oketsu. The reality is oketsu is like a waste of time, but we still check it. In the 90s, we used to say 80% of the people have oketsu, and it was kind of true. The problem with that is that we're no longer in the 90s, and there's reasons why it's changed. So for example, I can tell he has, I can feel his pulse on red 9. So, oketsu is left stomach 26, 27, could even be below kidney 16. Okay, so it's a fairly large area. None of my points are exact locations. So I don't care if you're Worsley school location or this school location, last school location, everyone's going to have slightly different ideas about where location is. So it's a vague area. There'll be only one place where I'm going to be very insistent that this is where it is. So we say, if he had pressure pain here, we'll call it oketsu. What does oketsu mean? We call the problem, literally translate to stagnant blood, but that's not what it means, because your idea of stagnant blood is, you use Taoren Honghua, you have a very different idea of stagnant blood. So this stagnant blood basically means there's usually something in the liver, doesn't mean he has a liver problem. The portal vein comes from the left side towards the right side to the liver. The food gets picked up in the small intestine, goes to the liver to be detoxified. Okay? And then this tells us that the blood is a little thicker. It's sort of a little bit more viscous. Okay? The people, originally, oketsu was discovered on people in asthma sanatoriums. and TB, people with lung problems. Lung, according to the Nanjing, is supposed to reflect on this side. It's the west. It's supposed to be, the lung reflex is here. So they were saying, how come? And the reason is because people who have lung disorders, immunity disorders, lots of infections. If you take a glass of water and put it, well, I don't know if in England you can, if it makes sense. If you take a glass of water, put it like in Switzerland in the Alps, you come back, you don't mind drinking that water 2 days later. It's like clear water. But you go to some swampy, I can think of Florida. I don't know what you have here that would be the equivalent of like, damp, swampy, warm area. You're not going to want to drink that water. It's just a glass of water that you left, but it's going to feel mucky. Okay? It's with the blood, if the body has many infections, the heat is going to make the blood more viscous and mucky. That's what oketsu means. So in the 90s, people, it was like the good era of, the .com, and, everybody had a little more cheese and more wine and this, that, and the other. And then 2000, I can only speak for the U.S. In 2000 we had an election. Do you know who won the election in 2000 in the U.S.? I know it's a little, okay. Well, okay, who came into power was Bush, but who won the election was actually Gore. Okay, so the first time in American history, Americans have 3 components that they rely on. We have a good economy, we're safe, and we're supposedly democratic. Okay, and you can have comments on that, but that's not the point. The point is this is what people believe. We had an election where wasn't one, we suddenly don't have a democracy in a strange way. We had Y2K, if anybody remembers, was this big economic upheaval. And there was a downturn in the economy. Granted, 2008 was much worse, but there was a downturn in the economy. And then 2001, of course, there was the Twin Towers, and you guys 4 years later had your own, So suddenly this was the first time America has ever been hit on its own ground. That is, for Americans, that's not normal. For other, if you live in Cambodia, well, of course we get stuff like that. I come from Israel, of course, yeah, big deal. But, it's like, so the 3 bases of life in America has changed, and what you find much more nowadays is what we call adrenals. So that will be your next finding. This is the one place where it's precise. So oketsu can show here, or it can show here, it's okay. But adrenal shows just below kidney 16, here and here, and you have a little bit, you have both sides, I think, more on the left.
Didn't feel too bad, I think.
Okay. Now, that's another thing. Every culture is going to have the English, in my recollection, when I taught here 15 years ago, the English are not so coming forward with what it feels like. And it's okay. It's just the nature of people. So you have to kind of you have to remind them. So I know it doesn't feel much. Now, I live in New England, and the people are very stoic. Okay? They don't say pain. So I have to explain to them. Okay. This is what my fingers should feel like. Does it feel different? Not pain, but does it feel different? Yes.
Tighter.
Okay. Okay. So you get to the whatever phrase they want to use. Some places it'll be obvious. It will they'll go here. Now we cannot. There's some sinking thing here, which will be interesting. So we can find out what does that mean or whatever. And it somewhat less tight here or the same tight.
About the same.
About the same. Okay, so my fingers it felt. So I'm going to call this adrenal. Now, so that's our adrenal reflex. You can sometimes find it just one-sided, but my suggestion is you assume if you decide it's adrenal, treat both sides, don't treat just the one side. Kiiko nowadays will do one side. She didn't used to. But her ex-husband started doing one side, and now she's picked up on it since then, and she is willing to do one side. I go with the idea of it may only show one side, but nobody says only my right side adrenal wanted. You all went to acupuncture school, right? So your adrenals got exhausted. Nobody says only this side adrenal is a problem. This side is perfectly fine. It's impossible. It's a gland that works. They work together. If one is depleted, the other one is. It's just. On the body, it isn't reflecting yet. So kind of like insurance, treat both sides. Okay. The original treatment for it is kidney 6 plus 27. We'll go through that all those things in a moment. But I want to talk a little bit about, okay, where does this come from? Because people say, we see Oketsu and we can understand portal vein, therefore reflex of the blood is a little bit stagnant. Where does this come from? So in school, do you remember the description of the kidney channel? Yes, no? You don't know what the kidney channel is? Okay. So it starts at the little toe, and goes up, and it specifically says to the heart of soul, goes into kidney 2, then it circles the heel, and there's no more points mentioned from there on. It circles the heel, goes up the inner thigh into the perineum. Now, what does it do now? This is the part where every acupuncture student has had difficulties. From the perineum, what does it do?
Yes, go to the lung, maybe? I'm guessing.
From the perineum to the lung.
Maybe.
Oh, that's cute, I like that. Can I connect?
The divergence, there's one branch goes up the spine.
T4.
Yeah, go ahead, that's a very interesting explanation,
One
yes.
branch goes up the spine,
Mhm.
in the central spine, and connects already with the kidneys, and another branch descends the
Is that what
abdomen.
it says? That's, you invented this, it's beautiful.
That's it.
No, and that's what most people will do. No, it's perfect.
Yeah.
There is the description of the channel doesn't match what you learned with the points, and that's exactly the dilemma that people have. The description of the channel, it goes up the spine into Mingman, goes into the kidney and down to the bladder. And then there's a branch that goes up to the chest and circles the throat. So people are going, what the hell do I do with this when I have, from the perineum and kidney 11 are very close. So it makes sense. Perineum, kidney 11, 12, 13, 14, 15, 16, 27. But the description of the channel that totally doesn't support that. Okay, so there's something weird going on. My understanding, you won't find it in any book, because the book tells you, the book doesn't describe 11 to 16, basically, but it kind of does. It tells you the channel goes up to Mingmen, which is in the back of the navel, and then it goes down to meet the bladder. So, now, kidney 16, the name of kidney 16 is Huang Shu. Okay? Huang means it's something in the body that's missing, gone dead, or either disappeared or dead. You can say either way. Okay, so the character above the body is Wang, not Huang. Wang, which means missing, gone. Okay, so like a dead heart, for example, would be will have that character also. Which means you're not engaged. Okay, so first of all, Huang is a very important character in Chinese medicine, because they say, nowadays we say Huang is the area between the heart and the whatever, we don't know what it means. That's another invention, we don't know what it means, but Huang, obviously, it's a missing organ, so there's something weird about it. So, and Gao Wang Shu, UE43, for example, we are, there's some reverence for it and stuff. So there's something about this Huang that's interesting. But the other thing is Shu. There's Shu points exist only on the bladder, as the back Shu points, or kidney 27, which is called the Fu Shu, the Shu of the Fu organs, supposedly, and this Huang Shu. So they only exist in the kidney and the bladder. There's something must be amazingly interesting and fascinating about Huang Shu, about kidney 16. So when the channel comes, it goes into the navel, then it goes down and goes up. So there's a channel, there is a divergence here. One goes down, one goes up, and that happens, in my understanding, at kidney 16. It splits this way. Some places where there's divergences, for example, stomach 5, it specifies the place. They say it happens here. In the case of the kidney channel, it doesn't say, we have to guess it. Okay? Now, if you have a shock or a trauma to you, okay, so we all have our own nightmares. So I'm going to give you one of my understanding of nightmares. Don't make too much analysis on it. If you're dreaming of something, say a train's coming at you and you can't move, your body is going to go like this. That's my experience. Okay, you're going to contract into kidney 16, and then the kidney channel. Remember, kidney is very susceptible to fear and shock. Is going to split. So the up and down are not going to be coordinated. Where it's going to happen is kidney 16. Okay, so that's why we say, my understanding is adrenal shows just below kidney 16, just below that split. So if you had a clock, this is 12 o'clock, 6 o'clock, 3 o'clock, 9 o'clock, we'll say 4 o'clock for the left side, 8 o'clock for the right side. Okay, and that's an exact location. Oketsu can be, you know, can be a little bit further out, a little bit further in. Everything, I don't have exactly, even for points, you know, not just for palpation, when I'm needling. Whatever worked on the patient is my point. I don't care what the book says. Okay, this has to be exact. So that's adrenal. Another very common finding which he has, do you see when he breathes, it's fluttering? Okay, we call REN9 pulsing. Okay, so REN9, and I can feel in my hand the pulse. You should not be feeling the aorta. Now, do you feel discomfort? Tight, something.
Not too bad.
Not slightly tight. Okay. But I can tell there's something because of the fluttering. Now, how about REN 12? 15. What's going on at 17? No. Okay, that's fine.
When you, sorry, can I just ask, when
Yeah.
you said not feeling the aorta,
You should not feel the aorta. The aorta is close to the spine. It's in front of the spine. So if you can feel it, even on a thin person should not feel it, because if you're feeling it, it means that the mesentery tissue is not solid enough. There's not enough tone that you are feeling. But in Hare's case, you can literally see that. You see?
yeah.
Yeah. We originally called it sadness reflex, but when you have the pulsation on REN9, so you can talk about it as two things. You can say that the heart can't contain emotions.
Mm.
So, for example, if you're angry at someone, but it's someone that you can't speak up to, you know, somebody in authority, like the Chinese example would be your mother-in-law if you're a woman. Okay? No, I mean, because you're underneath this person. That would be considered, you know, the heart can't contain it. And it actually relates to the spleen. Remember, the emotion of the spleen has to do with the yi, and the yi is the words of the heart, the intention. Yi is actually, the way it's worked out, is words over the heart. It's the words of the heart. What the heart directs you to do is the yi. Okay? So that would be one, but the other thing is we're saying it's weakness in the mesentery tissue. It's a weakness in the dantian. Okay, is what we say.
We were always REN 8 center pulse. Is that very different to what you?
I have no idea.
Okay.
One question I have, one request I have. I often can't relate to other styles of acupuncture.
That's fine, yeah.
Unfortunately. So no, you can ask. No, REN 8 is called the watchguard of the Shen. Shen Shui is the name of the point. Okay, so in a sense, I can't tell you if REN 9 is a substitute for REN 8, because what am I going to do? Like, excuse me? It's like, it's not very nice to poke in the navel. Okay, so I don't poke the navel, but I poke around. Now this REN 9 pulse, you're going to feel it further to the left also.
Okay.
In fact, it was when I felt Oketsu that I went, oh, he has a REN 9 pulse. We call it REN 9. It will extend upwards or leftwards. Very rarely you'll see it on the right, partially because the aorta is on the left-hand side. So if you feel pulse on REN 8, in my opinion, it's the same thing. But I can't say what Worthley meant or didn't. You know, I can't speak for that. But I would say, my guess is that it would mean something similar.
When do you panic and tell the patient to go and see their
Cardiologist.
cardiologist because you think it's an aneurysm? Yeah.
Okay, if it extends upwards, too far. So the more up it goes, the weirder it is. But do you have some digestive issues?
Never.
Why do you have, do you see how it's puffy here? We call pancreatitis tummy, you know, you.
I don't have sugar. I avoid sugar.
I didn't, I don't have sugar. Why do you avoid sugar?
Only because it's a good thing to avoid.
First of all, pancreatitis tummy has nothing to do with sugar,
Uh-huh.
just that you know. Sugar is a different story. Do you have, excuse me for asking, do you have gas, bloating, anything like that?
A fair bit, yeah.
Okay, that's a weak pancreas, because pancreas is enzymes, it's not just.
Yeah, digestive.
Oh,
Okay.
yeah. So he should, no, just to show, things show. So you can conceivably not talk to a patient, just treat the body. It's okay, you're allowed. But to me, that's not the style. To me, the style is this. you start with, always take medical history. So you seeing, like you filled one of those up, I'm asking, what did you have in your life? What did mother, father, and grandparents have? Okay. The medical history, what I'm trying to look at is, what is the first injury that this person sustained, which could be prenatal, okay, that is affecting why they're not healing now. So let's say the typical patient comes, there are many typical complaints, but let's say, oh, I went skiing 3 months ago and I fell and my shoulder is still hurting. I can't lift my arm. Okay, that's a relatively typical complaint. Now, the typical patient does not come 2 weeks afterward and say, I can't lift the arm. They go to a physical therapist, right? The physical therapist does the acute. They come to you and it's at least 3 months or 3 years later and there's something wrong, So you kind of go, okay, something extraordinary could have happened while they were skiing, but chances are that's not the case. I mean, it could be that. But there's a good chance that something else is holding this shoulder in pain or immobilized or whatever. And I have to find out what is it. I want to know what's going on besides the mechanics. Why is this person susceptible for the shoulder not moving up? Okay, and I'm taking specifically something that's musculoskeletal. So it could be that they have weak digestion, that somehow, or they have a thyroid condition, which would be very typical, because thyroid will show in the neck and the shoulders. It's just a typical. They may have a cardiac problem if it's on the left side. It may be a liver kind of person if it's on the right side. Okay? So you want to look at, what can I look at historically that this entity here is caught up in, and name it in some manner. So I can name for him, I can say, oh, maybe adrenal and weak dantian and whatever, but he also has pancreatitis tummy, and I can say, if I treat this, I want to see if his shoulder gets better. Because maybe that weakness is not what's not allowing the next problem to be dealt with easily. That's the style for me. So I take the medical history, I palpate the whole abdomen, and find out everything there is. In other words, the style is not to say, adrenal, okay, kidney 6, better? I'm just asking. Is this other okay. It was too fast for it. Okay. Do you remember this tightness here?
That's right, yes.
Okay. Kidney 6, height, how's tightness?
Yeah, it could be better.
It could still be better, is that
No,
what you?
no, it is better.
It is better. How much better percentage?
It's hard to tell because I've forgotten what it was like before. 83%.
10% increments is good enough. Okay. So in his case, I might say kidney 6 is the good point, and combined with 27. But the style is not find something and needle the thing that resolves it. That's totally wrong style, in my opinion. Okay. You'll see people teach it and see people practice it. That's not correct for me. For me, you find out the whole abdomen and see which is central. You want to find the central idea. Use that idea and see how much of the abdomen it fixes. The idea that fixes the most things is your root. So you start and you go, okay, this is my medical history. And you start thinking, okay, can I tackle this thing they had at age 5? And sometimes you can't. You don't know what to do with it. Like you go to, in Western medicine, you go to, I don't know, in this country if you have so many options, but in America, if you have insurance and you're willing to pay, you have many options. You go to one person and they say, oh, this is not in my realm, go to, they'll send you to a specialist. And the specialist will say, so you go to a specialist, you make an appointment, you go to the specialist, and the specialist says, oh yeah, you have yuck-itis, or whatever, they have a lovely word for it, okay? So, for example, you went to someone and they gave you a fabulous word that none of us know what it means, hypercalcio something, It's a lovely word, no problem. And we'll ask you what it means in a moment. And they give you some lovely word and then you say, okay, doc, what do I do with it? Now you usually get 2 answers. The first one is, well, now you go to someone who treats it because I'm just a diagnostician. Okay, I'm a specialist. I do this. Like that's what radiologists do. They don't even see the patient. They just get CT scans, stuff like that, and they tell you what's going on. So that could be one of the things. Or the other one, they can say, oh yeah, for yuck-itis, the Merck manual says this, or they may say, we don't know how to treat it. We just know how to diagnose. To me, to diagnose means nothing. Okay? First of all, the word diagnosis. Dia means what? To, and gnosis means knowledge. I'm going to give you a different interpretation of it, which is actually incorrect, because I'm going to say dia is like Dios. In Latin, I'm going to make it into Latin instead of Greek, which means heavenly. God's knowledge is diagnosis, because that's what MDs kind of think they're doing. So, it's like we think we're superior, and we're gonna come with the knowledge from, For me, diagnosis, to split knowledge into two is ridiculous. Two knowledges? Why? There should be only one kind of knowledge. So for me, already the word, but what happens with diagnosis, when we split the knowledge away from the treatment, it becomes irrelevant. Because who cares if I can name a disease if I can't treat it? Unless you're in that model where there are some people who name and other people who treat according to the name. Now, I will take the names the patient come in with. I love that. When they have a diagnosis, I'm always interested in what did the MD say? Because it gives me a place, it's part of the medical history. Okay? So, the diagnosis is relevant to me, and I can call something, for example, he's not very likely, but because women have thyroid much more common than men. And I can say this is thyroid. It doesn't mean they go to the MD and the MD say, oh yes, your acupuncturist is right, you have low thyroid or whatever. For me, it's thyroid. Now, my proof is, can I treat the thyroid? And if I'm thinking I'm treating thyroid and stomach 9 area gets better, then I confirm thyroid diagnosis. And once I treated thyroid, the rest of the abdomen, wow, gets so much better. It means thyroid was central to this person. And if it isn't, I thought he's thyroid, and I try and treat the thyroid, and it's not working. The stomach 9 doesn't go away, or rest of abdomen stays the same. Either, if stomach 9 went away, I can say, okay, yeah, he's thyroid, but it's not a central problem. Or I can say it's stomach 9 didn't even get better, then it's not a thyroid problem. If I try and I search for the point, because when I search, maybe slightly a few millimeters away will do a better job for the stomach 9. So I'm looking to resolve, the body findings, the palpation is a way to confirm my diagnosis through trying to treat it. If I try and treat and it doesn't work, I throw the diagnosis away and go back and try and look at, okay, what other diagnosis can I come up given this person's medical history, given the palpatory findings. So the style for me is, what's your medical history? What am I finding in the body? How can I correlate those two things? Come up with an idea of what I need to treat. Now I test this idea and see what it does. Literally, okay, I press this. How is your abdomen now? If it gets better, my idea was good. And now it's a question, how much better did it get, and how much did I knock off? And how is your symptom? Some people will have a symptom you can tell on the table, like, I can lift my shoulder, okay? Some people will have something like insomnia. Well, most of your patients sleep on the table. They don't have insomnia when they're at the treatment room. They have insomnia when they try and sleep at home. You can't test it. Okay, but you can test that the body is responding. What we're doing is, by pressing a point before we needle it, we're ensuring that the point actually has a relevance to the person, as opposed to the TCM thing, which says, spleen G deficiency, stomach 36. Okay, boom. There's no way to test that. Okay, this system is, the mark of this system is testing it. Is it affecting the body? If you're good at that, you can do it totally from the pulse. I have no problem with you doing the whole, confirming everything from pulse, because grandfather teacher originally did it from pulse. There's nothing wrong. You can do it from how they dilate the pupils. In fact, there's a woman I treat for a friend of mine in San Francisco. When I go teach there, this patient always comes, and now I know because I've treated her like 4 or 5 times. It's like, her eyes, when it's the right point, her eyes open up. And it's nothing to do with, there's just something weird in her nervous system that, that the response, and I look at the eyes and then I know whole abdomen changed. It's a weird phenomenon. It's not the norm. But whatever your confirmation system is going to be, it's fine with me. I just happen to do it through palpation. That's, That's what's convenient. Now, why is it convenient for me and why it may not be convenient for you? Number one, I'm a tactile person. You know, I'm Mediterranean, you know, it's like it's easy. The English may be a little bit more, you know, a little bit more reserved, may not be as easy for them. So a lot of people say to me, that's not for me. The system, Kiiko she used to laugh about this. She said, this is blue-collar acupuncture. You know, it's like you're touching people. It's mechanical work. You know, but don't confuse that to mean this is the whole thing. There is that aspect. Now, the other part, so some people just don't like, some people really like this sort of sitting across from you from a desk and asking questions and, you know, and doing this diagnosis and then having a prescription, and that's their style. If that's you, chances are you're not going to relate to the palpation. Okay, that's just the nature of it. The other thing is, one of the things that people don't relate to, but happens to work very well for me, is the patient is in full control. You can't do this thing where a lot of people do, excuse me, I'll imitate something that may look familiar to you. Oh, yes, you have, yes, I can feel the, what side are we on? Okay, this is the, like the spleen and the, it's like, sorry. No, this is the heart, the liver. Yes, in your heart, yes, a little weakness, a little, I'll give you a whole description. Put the needles in and you go back and say, oh, yes, the heart is much better. It's flowing so much better. And I know you've seen people who do this, okay? Now, this can be fabulous because a lot of patients love this kind of stuff. You know, a lot of people come, we're Chinese, we know we're esoteric knowledge, and they like, and placebo, you know, if you project, I'm good, the patient buys into it. The problem is the patient has no control over it. And I don't really understand the pulse well enough. But if I say, is this better? He's telling me if it's better. I'm not telling him if it's better. I can tell in my fingers, sometimes I can tell it's more tight, less tight, but he's in full control. And until he says better, I don't leave. Okay? Now sometimes you don't have a choice. Okay, it didn't work, it's okay. You're allowed to fail. But the patient knows, and the thing is when the patient goes, in his case it wasn't dramatic, but when a patient goes, ouch, and you press something and go, wow, gone. Are you pressing? You know, then the patient believes that that's my placebo, because I don't have the personality to come and, ooh, I have a fishmonger license, you know. It's like, I don't have this guy. No, Worsley had tremendous capacity. Whatever you may think, my one understanding, I never met him, but from everything I've heard, he knew how to relate to people. He was really good at extracting stuff from people. You know, both intellect, you know, like by words and making stuff move for them. And yet, this is a guy who claimed he got the stuff from the emperor's physician in the ancient times and didn't read Chinese. We all know he didn't read Chinese, you know, it's not a secret. So, but he had a personality that engaged people in the dream. He had the capacity to give them space, light, and new possibilities. Most of us don't have that. Most of us have to work with technique. Okay? So for me, when the patient, or if I can give the patient so-called placebo, excuse me for saying it in front of a patient, I think it's the best thing I can do for them. The real medicine is them, is my own engagement in the process is much more important for me. So if they can say, oh, wow, gone, now they go, wow, this Avi guy actually knows what he's doing. He's not some weirdo, you know, poking my belly, you know, or asking me weird questions about my bowels, because, you know, the Chinese are obsessed, you know, with we have 10 questions. Are you sweating? Are you hot? Are you this? Are you that? And it's like, you know, it's like, to people, it's like, why are they asking this? You know, I don't know if I'm sweating or not. I mean, you know, how many people don't, they have no idea what you're talking about. You know, it isn't relevant in their life. You know, how many people, you ask them something about the urine. Is it yellow? Is it clear? It's like, I didn't look. You know, so most people are not connected. No, seriously, they're not connected with their body functions. But when something hurts, something goes wrong, suddenly they're connected, but they don't think to look twice in the toilet and go, and then they go, I don't know if that's considered yellow, maybe it's diluted, maybe, I mean, how are they supposed to know? you know, some of the answers to these questions. That, you know, some do, but some will not. So this is very different. I don't ask any of the 10 questions, by the way. So that's kind of like what the style looks like. And what we'll do, I think it's close enough to 10:30, so we'll start with you. And then I'll give you the map, so we're kind of reversing a little bit the order. So if that's okay. Is that all right? Because, you know, I know you don't have, you're so kind of like, okay, that's what he does, you know, kind of like very theoretically. But you don't have a map of the abdomen yet.
Mm.
And it would be kind of nice if you thought you had a map of the abdomen. We'll always turn around and we'll prove wrong. It doesn't matter, you know. So, is that okay? We start?
You want
Yep.
All right.
Do you
Thank you.
want my shorts on or
Please.
these bottoms on? Because I've got shorts on.
That would be fabulous. Yeah. Especially hormonal issues. So by the way, one of the most important things for you in the class is not so much the lecture. Always look for, and by the way, if you ever go to Kiiko class, do the same thing. The by the way is often more important than the class. And people fall asleep and they go, oh, she said by the way. Like, I don't need to listen. It's exactly the opposite. By the way means, that reminds me, and that's where you get the clinical pros. So hormonal issues, which we know she is, often shows in this area of liver 9 area. That's why I insist that people bring shorts with them to treatments. Yes, come on. So know that this area relates to hormonal stuff. By the way, that's an Aviism. If you ask Kiiko about it, she won't know what you're talking about. So, and I will differentiate for you things that I'm saying and are definitely not from Kiiko, so you have an idea historically where things come from. But also, it's kind of it's not good to go to another teacher and say, this teacher says this. Well, you know, because then you're putting someone like Kiiko in like. I'm supposed to tell you what Avi says. Like, let Avi say whatever he wants to say, not my business. You know, like, why am I supposed to? I mean, it's hard for people to relate to what other people are doing, you know, because we don't often know what another person's doing. I know what Kiiko's doing because I've been around for a long time, you know, around her. But she doesn't come to my clinic and watches what I do. She doesn't give a damn what I do, you know, so she can't answer, you know. So just, you know, it's a respect for you. So let's play a game for a second. You may find out that taking your shoes off for this is good. So you want to be standing up while she's going to the room.
Everyone sits down.
So what you're going to do is, I want you to stand up with your feet slightly apart. If you can make them parallel, it'll be very nice. Don't force it. Okay, now we're not in horse stand. I can see you're kind of forgetting to do Tai Chi or something. So what I want you to do is, I'm going to call it, this is the heel, this is the ankle. Okay. I'm going to ask you to send the heel down press the heel down to the floor and lift the ankle bone, and the tendency is to roll over to the bladder channel once you do it. So what I want you to do is keep spleen 3 on the floor. Okay, keep the bunion bone on the floor. Press the heel down and lift the ankle bone away. What are you feeling? And relax the shoulders. I know it's hard because you're thinking. So what are you feeling?
My knees are eased.
Yes, thank you. Very nice. And okay. What you're going to feel is this inner yin area. We call inner yin is like liver 9, but on the kidney channel. We call inner yin. In the Chinese text, it's called Mu UB37, Xin Yin Men. Okay, is what that, but we call it inner yin. And what you're going to feel is you're going to feel this. Now, what I want you to do is mentally keep sending the heel down, lift the ankle bone. In your mind, feel that thing that you feel, the raising of the knee, the inner thigh, and allow it to percolate up. Just keep doing that action. Send spleen 3 to the ground, send the heel to the ground, lift up the ankle bone, activate the inner thigh. Now, some of you may feel something in the lower abdomen. Okay, so what happens is you basically kind of describing the kidney channel. You separated kidney 6, okay, and you're now feeling your perineum. which will lift up. And now if this, most of us are gonna have to do it in our mind, it's not gonna translate so easily to the body, because unless you have a very good connection, you should be, you may be able to feel the front part of your spine. I'm not asking you to feel the dew channel, which is in the back of the spine. I'm asking you to feel the front part of your spine. Okay? You might, and most of us will come up the spine, and at some point we're gonna get stuck. It's not gonna go any further up. Some of us, it will come all the way up to the throat. So, do you feel that? You may not, and it's okay. No.
Sorry.
Do you feel that? You're a younger teacher, so you do a good job unless you can feel it.
Yeah.
So, what, no, and it's hard for you because you have
Flat
such
feet.
flat feet, yeah. So press this down and lift this. Press down, lift this. Yes, yes, yes. Good, good. Do you feel more now?
Yeah.
Yeah, so the activation comes from the feet. Okay, let go. What I wanted to show you now, so we have a concept, so this comes from the yoga world. We have bandhas, you know, in the Indian system. One of them is REM 1, that's called the Mula Bandha. Okay, the root bandha, the root of, you know, it's kind of like, any of you gave birth, not the boys, but, you know, you've been taught Kegel exercises maybe? You know, now I understand that they're taught in different ways. It should not be muscular, you should not be contracting you're lifting the vagina. So for men, you're lifting the perineum diaphragm, okay? It should not come with a contraction of the butt. But I understand that many women are taught it. Yeah. But you're just lifting the pelvic floor. From that, the lower abdomen sort of lifts up slightly, and then, so Mula Bandha, Uddiyana Bandha, and the last one, if you get it all the way up here, your chest just naturally lifts, and then as a result, you can drop the chin into what's called Jalandhara Bandha. Okay? But so it's that elongation of the spine. I'll show you that in a second, afterwards in a different way. The trick here is to see how kidney 6, how important kidney 6 is. Okay, and how it controls that whole ankle area, how important it is, and now you see it in the thigh. Okay? So come in. So tell us about what's going on for you. Do you mind taking the sweatshirt off, by the way?
No, it's fine.
You don't have to do it right this second.
No, it's fine.